the tibia will just jump forward. So that is more than enough for diagnosing an ACL tear. You don't need very fancy tests. If you are very enthusiastic, you can do a number of tests. You can even invent. One of my friends invented an Elise test. So this is the only way, I think. And even then, if you are going to operate on a patient, you need a confirmation with an MRI. So I think these tests should be least painful or least irritating to a patient when you are going to diagnose them. Now, the second thing is that, these days, the traditional teaching has been like, if ACL is torn, you should operate. Now, this is good for someone who has spent his years learning in MBBS and MS Ortho, doing fellowships. So you learn a skill and you want to use that skill in every possible way. Your hospital is also very happy when you operate more. You don't operate, they don't feel good. So the indications for an ACL tear, ACL injury goes on expanding as per your practice. So if you're practicing in a medical college, probably my teacher will treat 1 out of 10 patients who present with ACL tear. But I think if I come into a corporate hospital, I will treat everyone. Because if I don't say that I treat, somebody else will treat. So why not I eat the cake? Why else someone else? So just to Dr. Vishesh, what is your opinion? Like, what should be the strict indication for doing an ACL surgery?
So you want to ask me about the injury?
I don't want to ask you, just one interaction with you. So what are your indications at this time for an ACL tear or doing a surgery?
So I think they talk about the grades of injury, right? ACL. The third grade is the most harm grade. If you have a third grade injury, then remember that it can only be treated by the surgeon. Till grade 1 and grade 2, it can be managed conservatively by the physiotherapy region.
Right. So actually, when you go to the MRI reports, they usually give you reports in two ways: it's a partial tear or a complete tear. So now, usually the dictum is that if it's a partial tear, treat it conservatively. If it's a complete tear, go for surgery. But I say, sir, that the indications, this MRIs and everything, they don't dictate us how to treat a patient. We are not going to treat an MRI, we are going to treat a patient. So I say, if a patient of 55 years of age, who has got very limited physical mobility, if he has got a complete ACL tear, will you like to operate? Probably I should not operate on him. I may operate under some pressures, but probably you should not operate. But on the other hand, I have got a 20-year-old male who wants to engage in competitive sports and has got a very minor partial ACL tear. What do you say? Should I operate or not? I think I will operate. Because I know that first of all, with a partial tear, he has not been able to perform or compete in sports. And second thing, one day or other, he is going to come back to me with a complete tear and also injuring some other important structures like a meniscus or a cartilage. So, first of all, we should take in mind, this should be very clear in our mind that we are not going to treat an MRI or an X-ray. Ultimately, we are going to treat the patient. So even if it's a complete tear, but the patient says, even if complete ACL tear is there, that doesn't prevent you from walking or even running normally. It is only the cutting sports, it is only when you walk on an uneven surface that you start having some problem. So if these things can be avoided, if the patient says, I do not engage in all these things, I don't think there is an indication for treating an ACL. The second thing is, these days,